One of the central pillars and principles of spine surgery is achievement of an arthrodesis. Many procedures in which we put instrumentation in will require that we achieve that, and I think being thoughtful about how we're going to achieve a fusion is important. There's a principle called the 3 O's of arthrodesis that I think are important to kind of understand. And I use an analogy around that to kind of explain it a little bit better. So there are 3 O's: osteogenesis, osteoinduction, and osteoconduction. And those are considered the 3 principles or fundamental requirements for getting a fusion. So I use the analogy of if you're trying to plant grass and get grass to grow, it requires that you have seeds, it requires that you have fertilizer, and it requires that you have soil. And without all 3 of those, it's impossible to really have the milieu. Like, you can't just put seeds in a dish and expect something to happen. So getting grass to grow requires those 3 things. And in a similar vein, getting bone to grow requires the same. So the osteoprogenitor cells, the cells that will become bone, or the seeds, so to speak, we call that osteogenesis, or the osteogenic component. The fertilizer, which is getting the grass to grow, and all the growth factors that are necessary for that, we consider osteoinduction. So the term osteoinduction references like the bone growth factors and things that are required to get bone to heal and bone to grow. And then lastly, we talk about the soil, or the matrix within which bone grows, and we call that osteoconduction. So you can think of osteoconduction as being the soil, osteoinduction as being the fertilizer, and osteogenesis as being the seeds.